What does fish skin have to do with healing wounds? Horizon Health's Dr. Wojnicki explains this remarkable treatment and how it's helping patients recover faster. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU TV's Being Well. I'm your host, Lacey Spence, and today we are going to be talking about wound care and fish scale. So if you happen to sit down to watch the show and had planned to maybe eat something with it, maybe just put us on pause, come back to us in a little bit. We do have some great information to share with you. Talking about this topic, we've got from Horizon Health, we've got Dr. Wojnicki here to explain the ins and outs of this topic. Welcome to Being Well.
Okay, thank you.
It's great to have you here, and I love for our viewers to be able to get to know who they're hearing from. So can you give us a little bit of your background?
Sure. I actually come from the Chicago suburbs originally.
Okay.
I moved here to Paris, Illinois for my job. I did athletic training for my undergrad at U of I in Champaign, and then moved on to doing podiatry school at Rosalind Franklin, which is in North Chicago, and then went on to do my residency at OSF St. Anthony's in Rockford, Illinois. And I got recruited out here.
Well, wonderful. I'm sure the area is lucky to have you. We love when our rural communities get to have access to just the best care, unique care. And our topic today, wound care and fish skin. So it's a little bit unique, but I would like to start maybe a little bit broader. So podiatry, you're under the podiatry umbrella. Mm-hmm. What types of treatment are you most commonly offering?
Well, just podiatry in general, I will treat basically anything that's below the knee.
Okay.
So we do wounds, which we'll talk about today, and that could be any kind of wound. Diabetic wounds, burns, some people get chronic wounds from having too much swelling in their legs, things like that. And then I also just do basic podiatry, as the fixing bunions and hammer toes, all that good stuff too.
Making sure we're wearing our supportive shoes.
That's
please.
right.
Okay. So when it comes to wound care, who is it for? You kind of touched on it a little bit.
Anybody who has a wound. For me, it's anybody who's the knee and below is who I treat. I can't treat anybody who's above that. But like I said, I've seen really, terrible burns of the whole leg that I've treated. I see a lot of diabetic foot wounds, but I also, like I said earlier, anybody who has chronic swelling of their legs, they can get wounds too. So basically any opening of the leg, I'm treating.
Okay. And so if I am seeking your care, and again, you said it was below the knee, am I starting with you, or have I expressed maybe to my primary care doctor first that I have an issue?
I get both ways. I see, people who say they went to the ER first with some kind of wound and then they get referred to me, or their primary care referred them to me. Or I've had people call the office and say, I think I have a wound, can I be seen? So really any of the above ways work.
All right, you're ready to catch them all under your umbrella. So at what point should someone seek wound care? How do they know that it's serious and not just like a basic issue that they can handle at home?
Especially, well, it's, you know, my patients who are diabetic, I say even little tiny openings, they can become serious problems really quick. So I
Okay.
say it's better to just come in to see me, even if you think it's a minor problem, because it can turn bad quickly. My patients, sometimes I see patients who don't have the best blood flow. Those ones, they can start small and go to a bad direction really quickly.
Yeah.
So I really don't say that there's any like time that's too soon to come see me. Really, any opening in your leg or foot, probably should just come see me and we can evaluate. And even if it's not terrible at the time, we could prevent it from getting worse.
Fair enough. Now, let's say I'm somebody at home and I have recently been diagnosed with diabetes, or I just have discovered that I'm living with this. And I'm completely new to why it's important that I see you early and that my wounds are maybe more susceptible to getting serious. Can you kind of explain the background? Why are they more at risk than the average foot?
I say my diabetics who are more at risk are ones that start having neuropathy, so they're not feeling their feet like you and I do, you know?
Okay.
So I've had patients that have stepped on nails and didn't even know it until they took off their shoe and their foot was all bloody because they just don't feel their foot. So those people who can't feel their feet, it's important to see me so we can educate them on how you can check your feet every day, daily, and when you should come in to see me if something arises. And also there's simple things too, like if you have a lot of callus on your foot, those calluses can get so thick that it can cause a wound underneath it. So if we're not keeping those calluses trimmed down, that can turn into a wound as well. So if you're not feeling your foot like you usually do, then those can turn into wounds. So educating my patients on that. I also say one of the best preventative ways to stop a wound is making sure your blood sugar is under control.
Okay.
So we look at something called the hemoglobin A1C, which looks at your blood sugar for a 3-month period.
Yeah.
And I say my patients who keep a 7 or below, they're lower risk for getting wounds than my patients who have a higher blood sugar. And I also look at their blood flow, because if you have good blood flow and your blood sugar is well controlled, your risk of wounds goes down greatly.
Well, and I don't mean to be ignorant to the topic, but when you talk about having a wound underneath a callus, I just always picture that a wound has to be something open, like a scratch or a scrape. So what does that mean that it's beneath the callus?
So I do like to educate my patients a lot on this, because when they come in with a callus and I trim down the callus, and then we find there'll be sometimes a wound underneath that callus, and they're like, well, I didn't have a wound before you trimmed down that callus. That wound was always there. That callus was just hiding it. So sometimes these calluses get so thick, it actually destroys that good skin that you have underneath and causes the wound. And so that's why when I ever see my diabetics, we trim down all their calluses to make sure there's no wound underneath, and it prevents it from turning into a wound.
And so the callus, it's like a thicker layer of skin. I only kind of know of it in the sense of like you get a pedicure and they break out that like cheese grater looking thing.
Yeah.
Is it more of an intense callus that you're dealing with in an office?
Yeah. So we'll see some patients that get really, really thick calluses. You know, more than just what your cheese grater is going to get off of your foot. Yeah, they'll be more intense than that.
This is totally off topic. Is that good for your feet when you get that done at like
The
a
cheese
pedicure?
grater? Yeah, as long as it's like a sterile instrument, then it's okay.
Okay, if it's clean, it's all right to do. I've always wondered that. I've had some folks, you know, they say, "Oh, I never get that. That's gross." But then if you're left with that thick skin, it can be uncomfortable in a shoe sometimes. Okay, all of that aside, since you were also bringing up diabetic care, again, if somebody is new to being diagnosed with that and they wear the compression stockings, what are those for?
So compression stockings are good for anybody who has a lot of swelling. And swelling can happen from, you know, your veins. As we get older, our veins have little valves on them, and sometimes those valves start failing. And so they stop pushing that blood through your system like it should. So that blood will just sit in your legs and then cause a lot of swelling. Sometimes it's from, you know, heart issues that blood is not pumping through like it should and causes that swelling. Well, if you get too much swelling, that fluid has nowhere to go but out. and that can cause wounds as well. And so wearing compression stockings to stop some of that swelling. I also tell my patients who have a lot of swelling, never sit how I'm sitting right now. Sit with your feet elevated while you're watching TV, things like that, because gravity is trying to pull all that swelling down. But if you can prevent your legs from swelling that much, then there's less chance of that fluid coming out and causing a wound.
Okay. Well, it's nice to finally have some doctor's orders. It's not just diet and exercise. Go ahead and kick your feet up. I can
Yes.
get behind that. So for our topic today, fish scale and wound healing, how did you kind of hear about this in the first place?
It actually came about when I was a student, a podiatry student. I was rotating through St. Vincent's in Indianapolis, and there was a doctor there that said, yeah, I'm using this new stuff, this fish skin, and I've had a lot of good luck with it. Well, I kind of just kept that in my mind. It was just a 1-month rotation. And I started my job here in Paris, and I had a patient that should be healing well, had all good tissue, all good blood flow, his blood sugar is under control, and his wound just kind of stayed the same. And I said, well, we need to add something that will try to make this wound heal. I said, I remember this fish skin. I want to try this fish skin. Was having a hard time getting his insurance at first to approve it, and the company said, you know what, we're gonna send you all the fish skin you need to heal this because we want to show you how well it works. He healed in 3 treatments and never had a wound again.
Oh, wow. And I'm sorry, how long had you been trying to get it to heal?
I think we're like at 4 months at that time.
Golly. Okay, so I have so many questions. How does one procure the fish skin? Like, I know you're getting it from this company, but like...
So they actually, it's Icelandic cod, and they, I actually got to go see how they make this, and it's, they get these huge cod. I mean, they're like this big.
Yeah.
And they get the skin off of it, and it used to be the fishermen in Iceland were, this was just scraps they were actually putting in dog food.
Oh, wow.
And there was a man he was from Iceland, but he was living in Germany at the time, and he saw all these people getting amputations, and he said, he was a prosthesis, and he said, there has to be something better than this. And he said, we use fish for everything in Iceland. So he decided, why don't we take this skin that they're throwing away and see if we can make it work. And they found that because there's no viral transmission between human and fish, they barely have to process this. So they really just freeze dry it, basically. They take that skin, freeze dry it, and then all I have to do is put a little saline on it and stick it on the wound.
Wow, so that like brings it back to life.
Yep.
Per se.
And so they barely process this. It's, a lot of wound care products, because there's viral transmission between different animals, they have to really, put it through a lot of different tests and stuff and take out a lot of the nutrients. With this, they don't have to. And so it's keeping all of its anti-inflammatory properties. And they found even with this fish skin that it will grow skin on basically anything. So they've used it on horses. They've used it even on a fish before, and it grew new scales.
Oh my gosh.
Yeah.
When you say viral transfer, I'm so sorry, what does that mean?
So like any diseases and things like that, there's no transfer between fish and human. So
interesting. Do you know how they even discovered that this was possible? I don't know if that came up on your tour or not.
It was just this guy who saw these amputations. He just knew that they used fish for everything in Iceland, so he was going to try this.
Is this like a somewhat recent discovery, or has this been around for a while?
It's been around, I'd say, for about 12 years now.
Wow.
But they just keep progressing and showing how well it's working. And a lot of people talk to me about, there was a Grey's Anatomy episode where they used fish skin, but this is totally different, and they weren't using Icelandic cod, and that's what we find actually works the best.
Oh, so you get to shop your fish scales and skin and figure out what worked best.
Yes.
So benefits of fish skin and the possibility of healing. you said that the healing rate, I mean, just for one, it wasn't able to heal,
Yeah.
but two, did it heal quickly, more quickly than other methods that maybe do work?
Yes, it usually when I put this on, all I have to do is put saline on it. I put it on the wound. We keep it covered for a week. We come back, and all of a sudden the patient has built a lot of new tissue, and the fish skin is completely gone, dissolved into the wound. And I have seen a lot higher increase rates of faster healing with this. And not only that, but fish skin is you hear fish is an anti-inflammatory. Well, the fish skin's an anti-inflammatory, so it actually decreases pain too when we put it in the wound.
Love that.
And they have actually done studies too that it protects against bacteria for at least 48 hours. And so a lot of the skin grafts that we put on don't do that. They can get infected easily. I have not seen any infection rates with putting on these grafts because they have that bacterial barrier. And they're actually they were looking into putting this in every person in the Army's backpack in case they were, in an incident where they got a big wound and they couldn't get to a hospital for over 24 hours, they can literally just put the fish skin right in their wound.
You can use fish for everything. Okay. Well, and with this, so you said that you wrap it before you send somebody home. I don't have to do anything once I'm home.
Nope.
It just stays covered.
On. Yep.
Okay, and then you'll determine whether I need to do another
graft.
round of it. Okay.
Yep.
What's the most you've maybe used so far?
I usually, it depends. So I've had ones where I've had a burn on a leg that was almost the patient's whole leg. Instead of using a skin graft, which would cause him to have another part of his body, skin removed from that, and that could be another wound, I used the fish skin instead. His took about 3 months, so it took a little bit longer. But he had a very large wound.
Yeah, intense wound.
Yeah, so it just depends how big the wound is compared to, that area. But he did go on to heal his whole burn of his leg.
Is there a smell to it?
You don't smell it right when you put it on. I'd say after a week, it gets a little bit of a smell to it, but we kind of have some tricks to try to prevent our patients from smelling that.
And those are? Tell us all your secrets.
It's like, certain dressings that catch drainage and things like that, because it does like to drain when it's incorporating. And so actually when you take off the dressing at first, it kind of looks ugly at first because it has this drainage that was sitting on there. And then once we clean that up, it looks much nicer.
Oh, okay. And so that shouldn't be something that I should be alarmed about, that I'm like closer to my appointment and it starts to get a bit of an odor. I'm not like, oh, I'm in danger here.
Yep. No, I warn my patients of that. That's usually pretty normal.
Not to scare people off, but just to educate. Are there ever any complications with it?
I really have not had any complications with it. I've used other grafts before, and sometimes those grafts have gotten more bacteria into it because it's just trying to get this tissue to grow. But I have not had that with the fish skin because it has this bacterial barrier that it uses. So really the worst thing that can happen is that it just happens to not work. Yeah. But I've had that very few and in between that I've not had success with it.
Now this is biology at its absolute coolest. I've never heard of anything like this. In your time using this procedure, are there any other cases, you've kind of touched on a couple, but are there any others that stick out where they've just had this miraculous sort of healing of their wounds?
Yeah, I actually had this patient that he already had an above knee amputation on his one leg. And when you already have an above knee amputation on one leg, you already have a only 50% chance of living in the next 5 years. It really can decrease your life expectancy. He had a terrible wound on his existing foot that he had. It had bone infection, it was draining. He did not have good blood flow to his foot. So what are we gonna do? And if he had this other leg amputation, wasn't sure how he was going to be able to live much longer with it. His family even told me they went to Jerusalem to pray for him, that something was going to change for him. And I said, you know what? We've tried everything. Why don't we just do a Hail Mary? We'll put some fish skin on it and see what happens. And he healed, and he's still healed, and it's been about 4 years now. And he's living a pretty normal life and is happy, and his family comes to visit me every once in a while. And he's doing great.
Oh, and what's that like for you to, you know, have kind of let this one little nugget of information from your past, it's somehow turned into this, and it's making a huge difference for people. What's it feel like?
I love using the fish skin because I get to see that big difference in people's lives. If I can save someone's foot and I give them that chance to live a longer life, there's nothing greater than that.
Very well put. We're in our last couple of minutes here. Is there anything that I haven't asked you about that you think is maybe important for people at home to know about this process or even podiatry in general?
I'm not really sure. I'm trying to think if there's anything that we missed. You know, I get a lot of people who think that podiatrists just cut toenails or things like that, but you know, I say that we kind of do everything, especially being in a rural area. You know, we fix fractures, we see wounds, we do bunion surgeries. We basically are the master of the foot. So anything of the knee below, it's not just trimming toenails.
Well, and it's your mobility at stake.
Yes.
I mean, my gosh, if you're talking from athletes to farmers to the average mom just trying to follow her kids around at sports practices, whatever it is, you know, you've got to be able to get around.
Yes.
One of the other questions that kind of relates to this, we hear a lot about debridement of wounds. Can you explain what that is?
Yeah, so whenever I get a wound in, you know, wounds a lot of times have this kind of yellow, greenish tissue to it. That's not healthy tissue. We want to get that tissue out. And we want it to be this red, what we call granular tissue that's sitting in that wound. That's what your body wants to heal with. So we take sometimes like a blade or a curette and we get that bad tissue out so that the healthy tissue can start growing. I also tell patients too that wounds get stuck in a chronic inflammatory stage. So your body doesn't like to heal chronic inflammation. So actually debriding the wound, making some bleeding come to there, tells your body, hey, this is actually a new inflammation and we do want to heal this. So a lot of my patients say, hey, why did you make me bleed? Well, that's how we heal things. We want blood to come to that area and we want your body to know this is a new injury and that it should heal it and not stay in that chronic inflammation area.
Okay, so it almost sounds kind of like it has to get a little bit worse before it can start to get better?
Yep, well, and we just want to get that unhealthy tissue out of that wound, else it can't heal.
Kind of wake the wound up and say, hello,
Yep.
can you please give this some attention?
Exactly.
As we're heading towards our last few minutes here, I do want to circle back to podiatry because, again, I think a lot of people maybe see cute shoes. It doesn't really matter what time of the year, but it's always a good reminder of what we should look for in a decent shoe so that we don't end up, no offense, having to come see you. What should I be looking for?
I tell my patients a really quick way that you can look at a good shoe is if you hold up your shoe, if you can take it and smush it in half, it's probably not going to be the best shoe for you. Because, you know, so sandals, I know it's sandal season. I tell my patients you can wear sandals, just don't make it your staple. So, you know, any shoe that you can collapse in half, you really want to be able to take that shoe, push it, and I only want that toe box to move. You want the rest of the shoe to be a pretty stable shoe. So that's what I really look for in the shoe. And I always tell them, it doesn't mean that you can't wear the shoes you love. Just make your staple a good, stable shoe.
And you mentioned that toe box. I think there's a tendency to run them a little too thin.
Yeah, get your feet.
So you want to find a wider toe box if possible, or
you know, you just want to make sure your toes aren't squished in there because that can cause, you know, inflammation of your nerves too on the bottom of your foot, things like that. So we just want to make sure that you're not getting squished in there, as long as your toes feel like they have enough room. And I usually say at the end of that toe box, if you can, you just want like a thumbnail space between the big toe and the end of your shoe.
And not to mention, if you exercise, your feet kind of swell up too.
Yes.
So you don't want them too tight. All right. Well, Dr. Brittany Wojnicki, thank you so much for filling us in on this really cool and interesting topic. I sure appreciate it.
Thank you.
Of course. And we thank our viewers for joining us for this episode of Being Well. We hope that you also learned something, and we hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.